Melasma is a very common skin condition which is often characterized by brown or grayish patches on the face. One of the causes of melasma is sun exposure. If in your family you see anybody having dark patches on their skin or melasma, most definitely you might get it. Melasma obviously is quite a complicated skin condition, and we need a combination of treatments for it. Lasers are great options for people with very stubborn melasma. Now, melasma is a complicated skin issue. It's a lifelong treatment actually. If you stop using sun protection, it will get worse.
Welcome to our podcast at Hana Aesthetics, where we go beyond the surface to uncover what really matters in skincare, beauty and aesthetic treatments. To navigate this, we have a perfect guest, Dr. Uktara Namshum, who is in the field for over 12 years, bringing science-backed insights straight to you, and today we are talking about melasma. So doctor, my very first question is, what is melasma?
So melasma is a very common condition, skin condition, which is often characterized by brown or grayish patches on the face, typically on the face, and usually you see it in women who are in the reproductive age group because of hormonal changes, etc. You generally see it around the cheeks, nose, forehead and chin area.
Okay. So doctor, what causes melasma?
Well, there are certain factors that are responsible for, increasing or causing melasma. So one of the causes of melasma is sun exposure. So sun exposure is said to increase the pigment-producing cells in your skin, which are called melanocytes. So when they are stimulated, obviously the dark patches also increase. Another cause of melasma is also hormonal fluctuation. So you see hormonal fluctuation, especially in women when they're pregnant, or if a person is taking birth control pills, or even hormone replacement therapy. So both estrogen and progesterone are said to increase melanin or pigment producing cells again in the skin. Another cause of melasma is also related to obviously genetics. If in your family you see anybody having dark patches on their skin or melasma, most definitely you might get it. And then there are also other conditions like excessive amount of stress, environmental factors like pollution, etc. And obviously not wearing sunscreen can all increase melasma.
So the most searched and asked question is how to treat melasma. What are the dermatological treatments to treat melasma? So doctor, please tell us about that.
Melasma obviously is quite a complicated skin condition, and we need a combination of treatments for it for most effective results. So there are various treatments available, like topical, and then procedures that are taking place in the clinic, and obviously lifestyle modifications. So now if we're going to start with topical, one of the most important topical treatments that's used in reducing dark spots or patches of melasma is hydroquinone.
Hydroquinone?
Yes, hydroquinone. Now how hydroquinone works, it reduces the production of melanin in the skin. So obviously if you reduce the production of melanin, dark spots won't increase. Yes. So you do have over-the-counter products and as well as prescription drugs. So over-the-counter products, usually they have a percentage of about 2%, while as prescription is usually 4%. There are obviously complications to it or mild side effects, like it can cause a bit of peeling and sensitivity to sun. So the other topical agent now we can talk about are retinoids. You must have heard about retinol, retinaldehyde, etc. So how this works in melasma is it increases the cell turnover, therefore reducing of so that dark spots sort of fade away. Obviously the percentages over the counter or prescription are anywhere from 0.025 to 0.5%. There are very mild side effects, I would say, when you start using a prescription or retinoids initially, which are like a bit of peeling, a little bit of redness that will go away as you use them. But obviously these treatments or products should be used under the guidance of a dermatologist.
Yes, definitely.
Yes.
So in the topical treatment, we talked about hydroquinone and retinol. So doctor, for sensitive skin like mine, are there any other ingredients in topical treatment to treat melasma?
So that's a great question that you've asked, especially for people with sensitive skin. Sometimes retinols can be a bit harsh. So there are other ingredients like azelaic acid. Now azelaic acid is an anti-inflammatory. and also a skin brightening agent.
Oh.
Yes. So over the counter generally percentages range from about 10% or so, whereas in prescription drugs is about 15 to 20%.
Okay.
Great for sensitive skin people. Other ingredients are like corticosteroids, very mild steroids that can be actually used in combination with other topicals. So they also decrease inflammation in the skin and enhance the results of the other treatments so that it's more effective.
Okay.
And lastly, we have vitamin C. Now, vitamin C is a great antioxidant and a skin brightening agent. It also decreases the production of melanin in skin. So therefore, obviously fading dark spots. Effective percentages one should look out in products with vitamin C is anywhere from 10 to 20%.
Okay, so these are all the things we are doing in topical treatment, but I would like to know what are the in-clinic treatments, like dermatological treatments to treat melasma.
So in-house or treatments in the clinic would include something like chemical peels and laser treatments. So chemical solutions help in exfoliating the dead skin over the face, and then so that you have healthier skin under it.
Okay.
So there are various chemical solutions that can be used for melasma or any kind of pigmentation. Some of them are like glycolic acid, lactic acid, etc. So these brighten your skin over time, but initially when you start chemical peels you might see a bit of darkening before improvement starts.
Okay.
Yeah, so that's one of the considerations that you have to think about before you start chemical peels.
So doctor, what about lasers?
Lasers are great options for people with very stubborn melasma.
Okay.
Yes, so some of the options that can use are IPL or intense pulse light treatment. So this is a laser therapy where light is passed to on pigmented areas to lighten them.
Okay.
So that melanin pigment is broken down and then the pigmentation sort of lightens over time. So IPL can be effective, however multiple sessions are required. And another consideration about IPL is on dark skinned people it can make pigmented areas much darker, so it has to be used with caution.
Okay.
Yeah. So another laser that is used for stubborn melasma is Q-switch laser, Nd:YAG Q-switch to be more specific. So this particular laser uses heat energy to target the melanin pigment in your cells and break them up into smaller pigment sizes, so that the dark spots sort of gently lighten over time.
Fades away.
Yes,
right.
it fades away. It's great for especially people with very stubborn melasma.
Okay. So treating melasma the right way can really give you good results. But what if it's done the wrong way? So doctor, what are some common mistakes that people tend to do while treating melasma?
A great question. So while treating melasma, there are certain things that a patient or a person should do, because any treatment can make your skin a bit more sensitive. So the first thing I would stress on is using sunscreen. So a lot of times, when a person is undergoing treatment, they don't apply sunscreen effectively, or even the right amount of sunscreen, or even the right SPF. For example, if you are undergoing treatment for melasma, UV rays can actually worsen melasma over time, and also because skin becomes a bit sensitive, it can worsen if you don't use SPF. So the SPF generally you should use is above 30.
Okay.
And do apply it throughout the day, as in if you're stepping out, apply it in the morning and apply it every 2 hours if you're out in the sun. Even if it's cloudy or you're indoors, one should apply sunscreen. Yes. Second common mistake a lot of people do is using very harsh products. Yes, they use a lot of harsh exfoliants. Yes, though it can exfoliate your skin, it can also cause irritation, and any skin irritation can lead to inflammation and therefore worsening of pigmentation.
Yeah, there's a very big myth that if you are feeling some irritation or sensation on skin, then the product is working. But what if it's actually irritating your skin, right?
Yeah, so a lot of times people don't understand that chemical or scrubs can actually cause a lot of irritation and inflammation, and it's not always a good thing that you should feel something harsh on your skin. So that is obviously a myth, and please don't use any sort of scrubs on your face that causes mechanical damage, because that can also increase pigmentation.
Okay.
A third common mistake that a lot of people make is, like I mentioned earlier, hormonal fluctuations can increase the risk of melasma. So it's always necessary to check if it's because of that and control it. Just doing over-the-counter treatment or laser treatments is not going to be effective if you have any sort of hormonal fluctuations. And the last mistake I would think that a lot of people make is being consistent with treatment. Now, melasma is a complicated skin issue, and obviously you need a long-term solution for it. It's a lifelong treatment actually. So if you're going to start treatment and then stop, it's not going to be effective. You see results after a certain number of months. You start seeing them
Will
then.
it increase if we stop the treatment?
Sometimes it can get a bit worse.
Okay.
If you're not, like for example, if you stop using sun protection, it will get worse. Right? And if you stop treatment, it's not going to get better. So therefore, it's very important to listen to your professional who's treating you, your doctor, dermatologist, and then proceed with the treatment.
So doctor, you just mentioned it's a lifelong treatment. So is there no permanent cure to that?
Well, like I mentioned earlier, melasma is a very complicated skin issue, and yes, because of the various factors like sun exposure, hormonal fluctuations, there is no permanent cure for it. Yes, all the treatments I have mentioned can help decrease a melasma and also maintain the results if you keep doing the treatment, but yeah, there is no permanent cure.
So I hope you enjoyed this podcast, and if you have any queries, comment down below. Don't forget to like, share and subscribe to this channel.